In today's Community Corner, we are recognizing National Suicide Prevention Week, and there are many resources here locally that everyone can take advantage of that provides information and help for those that are in need. And one of those resources is the Idaho Crisis and Suicide Hotline. So we're joined right now by Lee Flynn. She's going to tell us more about why it is important and how we can help when it comes to this very challenging issue, right? Sometimes it's hard to talk about, but it's important that we do, and most important that we recognize it and help those when they need it most, right? So it's all about communication. So as mentioned, it is Suicide Prevention Week, but why is it important that we bring attention to this? Why is it important that we're starting this conversation?
Right, it's a really important conversation, as you noted, and one of the main reasons is for all of us who live in Idaho and call this place home. Our suicide rate is nearly 50% higher than the national average.
Oh my goodness.
So we have a really big problem in Idaho, and it takes all of us to really try to prevent suicide.
Okay, and then tell us, though, too, about some of the resources the Idaho Crisis and Suicide Hotline offers. So how can you help when it comes to this?
Right, the hotline is 24/7, and we want people to know that they can call for any reason, if they're feeling suicidal, of course, or if they feel in some other type of kind of emotional distress. But for people who are feeling suicidal, especially, we want them to know they can reach out anytime, 24/7. They can text. They can call, and the new number is 988. And we're just always here, and we're ready to listen and support those who need it at their time of greatest need.
Okay, and Lee, though, I think sometimes when it comes to the topic of suicide, I think it's hard for those who really do need help and support to find that motivation to reach out, right? I think I hear quite often that it usually comes from a loved one, from a family member, a friend, a parent who might recognize behaviors, or sometimes as a parent it's just kind of that gut instinct, and sometimes you don't even know at all, right? We also do hear way too often where a parent's like, I had no idea, or a friend is like, I had no idea somebody was suffering. So let's talk about some of those red flags.
Sure.
Maybe some of those gut instincts, maybe some of those things where you're like, oh my goodness, I had no idea that could actually indicate that somebody I love or know is struggling.
Right. It's like you said, sometimes it's really hard to know. And the first thing that we like to let people know is, really trust your gut. Whether it's your friends or your family members, sometimes you just get a feeling that something's not quite right. And if you get that feeling, really trust it and talk to the person that you're concerned about. One of the most important things a person can do is to, if they're concerned about a loved one, is to ask that person directly, are you feeling suicidal? And to ask calmly in a neutral tone. And although it sounds counterintuitive, that can be one of the most important things, is to reach out, ask the question, use the word suicide, and if they are not feeling suicidal, they'll let you know, and if they are, it could be the opening that really changes that situation and helps them get the help that they need.
So don't dance around it.
Do not dance around it. Do not ask, you're not thinking of doing anything crazy, are you? Ask directly, you seem like you're not yourself lately. Are you feeling suicidal, or are you thinking of suicide?
And then what do you do? What do you do if somebody you care about says, yes, I am?
Right. If a person does say yes, then, take some time to listen to what's going on with them. Let them, give them the time, give them the space to listen, and let them talk about it. And then when you get to a point where you understand what's going on, help them connect with the help they need. And that could mean probably in a lot of circumstances, that could mean if they're not connected to healthcare, to help them connect to healthcare and to a medical provider, or if they have someone they've been seeing, connect them to their doctor. So get them connected to healthcare. And get them to, if they have access to lethal means, if they have a suicide plan, if they have access to lethal means, help them come up with a plan to restrict their access. You know, commonly that could mean that they've been stockpiling pills, so try to get that medication away from them. In a state like Idaho, almost everybody has guns, and so it's really important in a situation where a person is feeling suicidal to ask them, you know, what their plan is, and if they have guns, to ask if you can maybe take their guns for a while until they feel better, and you know, and then you can give them back. But absolutely, if a person is feeling suicidal, if they've already made a plan for suicide and they have access to lethal means, you know, and again, that could mean pills, it could mean guns, it could mean any number of things. It's really, really important. That's a very serious situation. So the most important thing a person can do is help that person get a higher level of support, and again, connect to a healthcare provider for one thing.
Okay, so healthcare provider seems to be an absolute must go to. What about leaving that person alone? What if it's a situation in which maybe they don't live in a household with you? What if it's a friend? Should you make sure that you are present for them?
That would be very helpful. If a person is living by themselves, it might be, you know, it might be a good way to support them to ask if you could stay there with them, or maybe you bring them into your home. It's a really tenuous situation, and so it would be really important that that person is not by themselves, at least, you know, at least through this crisis. The crisis isn't going to last forever, and it's important they get connected to the support that they need and the health care that they need.
And again, that support is available through your hotline, through your center. So where do people go to learn more so they can make sure that they can access those resources if they're helping somebody or if they need help themselves?
Sure, there's information on our website, and again, we are a 24/7 crisis line. And so, you know, for people who feel suicidal sometimes, or maybe persistent suicidal feelings, we're always a resource, and they can reach us anytime. A lot of times a person is feeling in crisis and feeling suicidal for a short amount of time, and so often we are able to support a person through a phone call or a text. But again, sometimes a person needs a higher level of care, and in those situations we do encourage people to see a healthcare provider. Other resources here in the Treasure Valley are crisis centers. Here locally in Boise, we have Pathways Crisis Center, and they provide excellent crisis support. A person can go there without an appointment. They can drop in. They're open 24/7. And you know, while we talk to people on the phone or through text, with Pathways, a person can drop in and talk to a person, talk to a clinician in person. So it's a really important resource for people to know about. And again, either for the person who's feeling suicidal or a loved one. You know, a loved one could take a family member there, if they're concerned about someone.
Lee, thank you so much. Such an important topic and such important advice. Greatly appreciate it. And I know we've had the contact information up our entire conversation, so please be sure to write that down. All right, everybody, there will be more Idaho Today coming up right after the break.